Thanks for joining us for today's podcast. I'm Sean Schmidt with The Silver Sheet. The ever-evolving shift from physical medical devices to connected digital devices, such as apps for smartphones and tablets, brings with it a bevy of challenges to overcome now and in the years ahead. But manufacturers that implement a so-called system of quality model will be best suited to assess traditional quality management systems in preparation for the many digital devices entering the market, says Francis Blacha, Eli Lilly's global quality leader for devices. In this Silver Sheet visual podcast, Francis also discusses how manufacturers can use a system of quality approach to support the development and commercialization of digital devices. This podcast is a preview of a presentation that Francis and fellow colleague Bob Banta will give at the upcoming MedCon 2015 Industry Conference, hosted by FDA and Xavier University. So what do you have for us today, Francis?
Hey, Sean, thanks for inviting me to participate on this podcast. I'm excited about MedCon 2015, and I consider myself fortunate to be able to present this year. I've always found MedCon to provide a unique opportunity for the attendees to hear industry representatives discuss and share experiences associated with burning topics facing the industry, and also provide the opportunity to work side by side with regulators to get an appreciation for what is happening on the other side of the fence. So with that being said, I want to take a few minutes to discuss what we'll be sharing this year. Myself and Bob Banta will be presenting really two basic things. Our presentation deals with how you can use a system of quality approach to enhance modifications required to a device quality management system in order to support development and commercialization of digital devices. And secondly, the majority of the presentation will share lessons learned from case study perspective. We will discuss how using this system of quality and how it provides the context for performing assessments of our integrated standards, business processes, organizational elements, and management oversight processes. On the next slide, we see an evolution from physical to digital devices. Medical device and drug device combination product companies have responded to evolving technology of mobile medical apps since their introduction back in 2008. With this evolving shift from physical devices to connected device digital devices, the product commercialization paradigm shifts, as you can see in this simple example. On the left, we see a traditional mechanical injection pens. We look at instructions for use, which are printed, as well as labeling. The patient inserts are printed, secondary packaging is required, and cartons are required. However, as we move to the right, as we get to a digital device, we see that the instructions for use actually now appear on the screen, as well as labeling. There really aren't any patient inserts. No second packaging or cartons are required. During our presentation, we will be discussing a system of quality model that can be used to assess a traditional device QMS in preparation for the introduction of these digital devices, as well as share some of our own experiences during this journey. As there are countless variations of digital device configurations, not everything we will be discussing will apply equally to all digital devices, but most of what we will share will have relevance to medical device and drug combination product companies entering into the digital health arena. So to begin with, let's look at some of the elementary commonalities and differences between physical and digital device, as we can see on the next slide. This table identifies some quality system element commonalities and differences between physical and digital devices. Software, as medical devices, or SAMDs, have different regs and standards to comply with, such as the FDA's final guidance on MAAs, the EU's MedDef 2.1/6, FDA's final guidance on management of cybersecurity in medical devices, and the IEC 62304 standard on medical device software, just to name a few. Software-specific development processes are typically nonlinear compared to traditional linear models. For example, agile practices documented in AAMI TIR 45/2012. This type of development practice incorporates coding sprints, which are intensive coding periods that drive extremely fast code development cycles compared to conventional linear physical device commercialization cycles. Another difference is that SAM technology advancements have driven mobile platform operating system updates several times a year, forcing the mobile medical apps to react to these updates. Another technology area that differentiates SAMDs from physical devices is the use of near-field communication, NFC technologies, like Bluetooth for wireless exchange of data. NFC technologies drive additional risk management practices to address vulnerabilities and risk associated with managing SAMD patient privacy issues. SAMD technology also enables human factor studies execution from the perspective of being able to react to what is learned in the HF study one day and practically respond overnight with updated software for the next day. One major technological difference is the use of cloud infrastructure interacting with SMDAs. This leads to complex issues such as security authentication, encryption, supplier management of cloud vendors. Let's not forget about recalls and market withdrawals. With SAMDs, there is no physical product to be returned or collected. Other differences for SAMDs from physical devices includes management of labeling and IFUs, where no physical labels are attached to an SAMD. With connected devices, there is a growing momentum towards the establishment of interoperability standards like IEEE 11073, Health Informatics, the Medical Health Device Communication Standards, which are advocating for open architectures so medical data can be shared across apps and platforms. As the Internet of Things and the system of systems technologies evolve, SAMDs will have to exist in this emerging technological landscape. Moving on to the next slide, I'd like to shift the focus to briefly discuss how you can use a system of quality to help design or modify an existing device QMS to support the development and commercialization of these digital devices. So what do I mean by a system of quality? A system of quality is analogous to a quality culture blueprint. It addresses, among other things, integrated standards that define quality objectives, or so to speak, rules of the road, business processes for operational support, someone like a playbook, organizational requirements for roles, responsibilities, and accountabilities, identified here as players and referees, and governance and management oversight as owners and ownership processes. Following a system of quality can result in high-quality products plus accurate and complete safety and efficacy data. The foundations of a system of quality rest with sound scientific principles, balancing product commercialization effort commensurate with risk, and always employing continuous improvement rigor in everything you do. Going to our next slide, we see an example of one of the building blocks shown on the previous slides used in a system of quality. This building block is integrated standards. For example, here we see 4 of the key regulations and standards applicable to SAMD. During the presentation, we will share with you how, upon completing a standards assessment, we progress to identify applicable risk-based SAMD deliverables and transform those deliverables into a design control lifecycle model. Throughout the presentation, we will discuss each of the 4 building blocks in more detail. And then on the next slide, from a quality perspective, as I mentioned before, the main portion of the presentation is reserved for sharing some of the experiences. As we can see here on this final slide, it's based on lessons learned. For example, experiences we had using a nonlinear software development lifecycle process, and its impact on the quality management system. We will share experiences on what it took to work collaboratively with the information technology partners in managing cloud vendors. Also new for us was integrating cybersecurity requirements into the device risk management process. And as I previously mentioned, enhancement of human factors study design and testing to support rapid iterations resulting from rapid software code updates. Also, defining the process for recalls and market withdrawals in the context of supporting commercialized MAA, SAMD digital devices, as well as defining the requirements for post-launch market surveillance for these new digital devices. And really, holistically, the challenges associated with developing a global risk classification process for digital devices as a result of recent FDA, EU, and international medical device regulatory forum having published their own unique guidance information. So Sean, that's a high-level summary of what we were sharing. Thanks again for the opportunity to discuss our presentation.
Thanks for the great information, Francis, and we will certainly be looking forward to your presentation at MedCon. And thank you for listening, and please visit thegraysheet.com for more podcasts.